everybody, Luke Gordon here, and in this video we're going to talk about 3 mistakes to avoid when looking to treat lower back pain and sciatica. And if you've watched any of my other videos, you'll know that I have a lot of videos in terms of helping you understand what causes back pain and sciatica, trying to do certain things to determine the root cause, whether it's a disc issue or a degenerative issue, SI joint issue. So there's a lot of information I have that's more specific to really digging into those. So this video is more of an overview though. So if you've been working on some of those things and trying them and still not quite getting the success you want, this video might give you some ideas as to maybe something you're missing. So we're going to talk about the 3 mistakes that are very common for clients to make and potentially how you can avoid making those. So the first mistake, as I mentioned, I've talked about the root cause of back pain and sciatica, top 3 causes as I call them. And again, we've talked about, is it a disc? Is it more of a joint or degenerative issue, or is it SI joint dysfunction? So those are what you tend to think of as the root cause. However, if you've gotten kind of stuck at that level, what you potentially need to do is realize that the root cause could be something a little bit deeper or something completely different. So let me explain that a little bit. So let's say that we figured out that you've got an SI joint issue, or let's say disc issue since it's a little more common. So it's a disc issue, and you're trying to do the exercises that you've looked up or that I've shared with you about how to treat a disc, which largely is like extension-based, back-bending-based exercises. And you're getting some temporary relief, but nothing is really improving dramatically. Well, potentially what you want to then ask yourself is, why is the disc irritated? So what's causing the disc to be irritated? For a lot of people, it could be a problem in the ankle or knee or hip. It's an old injury or a pain there that's throwing off your mechanics, the way you move, the way you walk, the way you stand and sit, because you're favoring that side and you're shifting your weight away from it. Or for a lot of folks, it's the fact that they're sitting awkwardly at a desk or a computer all day, where they could make some improvements there in terms of their posture, or maybe standing more often or walking more often. So that's a good example of, again, what's the real root cause? Could be a couple things like that. Could be an old issue compounded by the fact that you're sitting too much during the day. So dig a little deeper if you feel like you're stuck at the root cause level. So that's a really big mistake to avoid making if you can. Or again, if you feel like you're stuck, just ask yourself some better questions or some questions that'll take you a little bit deeper. So that's the first one. Look for that true root cause. And then if you're doing treatment, especially, I'm a physical therapist, so if you're working with a physical therapist, which I feel like I kind of know that realm, and you're not getting the results you want, what I would highly encourage you to do is just kind of see if the therapist is really focused on helping you with pain relief, which is what I would consider your first priority with any treatment. When it comes to my view of how therapists should be helping you with pain relief, it is of course educating you on posture and exercises and stretches, but for the majority of clients that we work with early on, it's got to be hands-on treatment. So are they doing the hands-on treatment to have a positive influence on that disc, on the joint, on the muscles, wherever it is? Are they really actively helping you take the pain away by putting their hands on you? Now the way this fits into kind of the way I look at it is I call it the 3 phases of recovery. You may have seen me make these videos before on 3 phases, but essentially the first phase is pain relief, that red area there. So the first handful of your visits, whether it's the first 4, 5, 6, whatever, ideally the therapist should be helping you with pain relief with hands-on therapy. That doesn't mean you're not going to have some stretches and exercises, and like I said, some education about ways to move, ways to sit, ways to stand, things like that. Those things are all very, very helpful in that first phase. But if you're seeing your therapist for 30 minutes or an hour, they should be dedicating at least 2/3 of that time to putting their hands on you to take the pain down. So that's the second mistake to avoid, is that you're working with a therapist, but they're not really helping you with the pain relief phase. They're not putting their hands on you. They're not getting your pain level down. They're trying to jump right into phase 2 and make you start exercising and stretching and doing things that potentially, if done out of order, are going to make you feel worse. So a red flag for you, if you've done physical therapy for back pain and sciatica, you go in, they don't do anything really to help you relieve your pain. Instead, you just start right off the bat with the 5 or 6 exercises and stretches, start working on your core, start working on your hips, and you end up feeling worse when you leave. That's a red flag that you just don't have the right therapist with the right approach. So I would say find a different therapist, talk to someone else, get their approach, get a second opinion. Any type of therapy, physical therapy, chiropractic, if after the first 4 to 6 visits you aren't feeling any better at all, you want to start asking questions about why. Is this the right approach? Are we on the right path? What needs to happen for you to feel better? So that's the second mistake. Don't skip phase one with your therapist. Don't skip pain relief phase because that's where it all starts. Lastly, then, the third mistake to avoid is that if you do have a good therapist and you do end up getting someone who's helping you relieve your pain, could be a therapist, could be a chiropractor, could be massage therapist, whatever. But if you do find someone to help you relieve your pain, don't stop at pain relief. It's kind of almost the opposite of the second one I just said, but it's just a little bit different. So you do definitely want to spend time relieving your pain. That's what it's all about, to get the ball rolling. But ultimately, if your goal is not just pain relief, it's to be more active, it's to do golf, it's to do walking with your spouse or getting out with your friends or picking up your kid off the ground. Whatever it is that you're truly hoping to achieve after pain relief, keep doing your therapy to achieve that level. Because what will happen is if you go and you just do pain relief and then you stop because you're busy or it's costing you some money out of pocket or whatever, life gets in the way, then what will happen is your pain relief will be temporary. In other words, after pain relief, you need to do the right stretches, the right exercises to keep yourself from going back into pain relief. So again, 3 phases wise, we're talking about pain relief first in that red phase, and then we're talking about let's improve strength and flexibility, and then ultimately in the green phase, phase 3, let's make sure all these gains we've made have applied over to the activities that we want to do and that we feel comfortable now, you feel comfortable now maintaining that, preventing the pain from coming back. So get through all those 3 phases with a skilled professional. Make sure you understand exactly what you need to do to maintain the gains you've made, and don't get stuck, kind of going up and down in terms of temporary pain relief, and then you have a flare-up, and then you lay around for a while and can't do anything and get depressed, and then you go back in for treatment and ride the roller coaster. So try not to get stuck in that kind of vicious cycle. So again, those three mistakes, make sure you really understand the root cause of your pain, dive a little deeper, dig a little deeper if you need to, get the help of a professional in your area. Second mistake to avoid, make sure you're working with someone who is going to help you with pain relief. Don't skip pain relief, don't skip phase 1. And then third mistake to avoid is if you've gotten a good therapist or someone to help you with phase 1, don't bow out so early, don't stop, keep working into the strength, the range of motion, flexibility phases that you need to maintain those gains. That's the message for today. Thank you for watching. Of course, if you have questions, leave them below the video. I'll do my best to get back to you, and have a great day. Thanks.